Hi everybody, thank you very much for joining me for another one of our tea break talks. And today I've got my trusty cup of tea and my colleague Lowri. Hi Lowri.
Hello, I also got my trusty cup of tea.
Coordinated today with our polka dots.
We are.
Lowri's been working with us on a project into mental health in children with rare genetic disorders. And this is a bit of a bittersweet chat this morning, Lowri, because it's going to be fab to hear about everything you've been working on in the last 3 years, but also a bit sad because the project's come to an end. So I have to persuade you back to chat to me about something again in the future.
Yeah, definitely. I think it will take too much persuasion, so anytime.
No, and we've had a few chats, haven't we, over the length of the project. I can't believe the 3 years have just gone. But I don't know, could you just start by just reminding us what the project was all about and what it set out to achieve?
Yeah, of course. So the project was, I guess the overall aims of the project were to improve sort of the access to information and support for children who have a genetic disorder or genetic condition that makes them a bit more, vulnerable to developing through a neurodevelopmental condition or a mental health condition. And so basically we were setting out on this project because we know from the research at Cardiff University and the stories that I guess the staff at Cerebra hear from families who use services, that mental health is a real area of struggle for families in trying to access support. So that was basically the aims of what we were trying to do. Okay,
so what sort of things have you been up to as part of that over the last 3 years?
Yeah, it's been a funny 3 years because time's gone, it's felt really weird. It's either gone really fast or really slow. But thinking all the way back, I guess we started by trying to gather information and do some research around, the specific challenges that families face when they're trying to access mental health support, but also from the kind of service providers view, so healthcare clinicians and charities about the challenges they face when they're trying to provide mental health support. And then that was really the kind of foundation then for what came next. So from that information, we started trying to basically improve information and resources available to families that addressed gaps, so things that weren't already available. And try to work with stakeholders then to see how we could improve access to services.
Okay. So I guess just wanted to ask you what the sort of the key highlights for you have been. What if anything were you most surprised at, or what were the eye-opening moments, or what were you most proud of, or the highlights really for you?
Yeah, I think the highlight really for me was the amount of people that, being involved in this project and the amount of people that I've been working with. So I've learned a lot over the past 3 years from everyone who's been involved. From everyone in Cerebra to, this was a project between Cerebra and Cardiff University. So I've learned a lot from the people at the university as well. And then one of the really key points of this project was to engage stakeholders. So that included, professionals and also charities and parents as well. I'm really hearing from, their point of view about the experiences that they've had. Has been eye-opening, I guess, for me. I've learned a lot. And I think, the stakeholder group that we did form, so just taking it back, within the first sort of year or so of the project, we formed a stakeholder group who really fed into all of the activities we were doing then for the remainder of the project. And it's been a really valuable group to learn from, but I think all the members learned from each other as well. And I guess that's been the highlight for me, is the collaborative effort that this project has been.
Yeah. And were there any sort of major points to come out of all of the research, anything that you identified as being of critical importance or really needed?
Yeah, so one of the really key, there's lots of things that came out of the initial research, one of which was kind of the struggle that families have kind of navigating services. Where do we even start when trying to access support? And so what we were trying to do, and we were quite limited, when COVID came about, that really kind of hindered what we could do in this regard. But we were, planning on trying to pilot a kind of care coordinator role for families, specifically families who have a child with a rare condition, to really help them kind of navigate that process of trying to access the services they need. So that was a real kind of key point of this project, which if possible for us to continue in the future, we will pick up that work. And also we've created information leaflets and a really valuable resource that we think will be available for families and professionals soon is a workshop that we put together. So we've created a workshop for Cerebra to deliver to parents and professionals all about mental health in children with a rare condition, and kind of information about the risks for children, and what to do when people are concerned. So yeah, I think that should hopefully be really valuable when it's ready to be rolled out.
Yeah, so that's a really key thing to come up, really, isn't it? That all of the work that you've done has translated into something that is going to be of practical help, as you say, to parents, carers and professionals. So
Yeah.
I guess that was going to be my next question, really, is where does it go from here? But you kind of just answered that. So we've got this workshop in development, which we can hopefully roll out in the future.
Yeah, so that's the kind of work in progress at the moment. And what another really kind of lovely thing is that the stakeholder group that I mentioned, everyone wants to continue meeting up and things, so we'll have more sort of interesting things so that those links aren't lost. And yeah, so that's really nice as well.
Yeah, that is really nice and positive, isn't it, and supportive. So that's going to continue. So, but what's next for you, Lowri? Because I know you've come to the end of this project. So what are you moving on to?
Yes. So I am for a bit completed my PhD. So I've got a little while left to go still. My PhD is looking specifically at the school experiences of children with a rare condition.
Okay.
And how those experiences impact their mental health. So working on that, and then in a few months I'll start on a new project at Cardiff University, and that's looking specifically at the link between physical health and mental health and how they sort of impact each other. And I'll be involved in kind of the patient and public impact side of things. So I'll still get a lot of engagement with stakeholders, which is really nice.
Yeah, and that all sounds really exciting, and I think there are lots of opportunities in there that I can use as an excuse to have a chat about. So that would be lovely. So I can't really end our last tea break talk, Lowri, without sort of raising my mug and wishing you all the very best for the future, and thank you for everything that you've done over the last few years. And just to ask you the really critical question, really, which is, are you a biscuit dunker?
Yes. Well, I think it depends on the biscuit a lot of the time.
Well, I was going to say, because if you are, what is your recommended dunking biscuit?
Well, my preference for a biscuit is always a chocolate hobnob.
Okay.
And I do think they're good to dunk because they don't get as soggy as quickly. And I'm not a fan of a soggy biscuit. So it's my preferred choice.
We were chatting about this in the office the other day, and it created quite a debate. So I'll add you to that We might start doing a poll.
What was yours then?
Oh, mine's a chocolate digestive.
Oh,
Yeah.
same kind of class of biscuit.
Yeah, same, along the same lines. Oh, thank you, Lowri. It's been lovely, lovely to catch up with you. And as I said, all the very best with everything.
Thank you. You too, Elaine. I'm sure we'll stay in touch.
Yeah, I will. Bye.
Bye.